Hello, my name is Robert Rocha.
Hello, my name is Gabriela Peña.
Hello, my name is Marisa Parra.
Hello, and my name is Rebecca Alvarez.
And today we're going to do a presentation on a novel approach to support rapid data collection, management, and visualization during the COVID-19 outbreak response in the World Health Organization African region. It's going to be on the development of a data summarization and visualization tool.
The timeline frame of COVID-19 has a remarkable dates as follow. The first case was found in Wuhan, Hubei, China in December 2019. The WHO declared COVID-19 as a public health emergency of international concern on January 30th, 2020, and declared as a pandemic on March 11, 2020. On November 2020, the COVID-19 vaccine from Pfizer and BioNTech has a 95% effective, and the Moderna vaccine reduces the risk of COVID-19 infection by 94.5%. Since it's discovered as a highly lethal virus, COVID-19 has spread throughout the world as hygiene education in many countries has been neglected to focus on the other factors of great importance such as food and the economy. Being hygiene the most important first step to combat the transmission of any disease. Once the easy transmission of COVID-19 in China was discovered in 2019, health organizations worldwide decided to ask the policymakers of each country to take extreme and accurate decisions to stop the spread of virus, resulting in almost a total lockdown of daily activities in many places. Due to the quarantine at the beginning of the pandemic in many places, it has been impossible to monitor the disease, so different alternatives had to be found to carry out the follow-up of patients and with whom they had been in contact. The WHO had made new systems to continue with the surveillance protocols that needed to be carried out when a disease emerges. However, due to the promptness of the spread of the COVID-19 has, systems such as eWords, which is the early warning alert and response system, had to be implemented, or electronic disease early warning systems, and the eWords in a box that had to be complementary to eWords since many areas were closed or quarantined. AMET 2020. All these above mentioned systems serve as a basis of many others in order to collect information and thus to be able to follow up on patients. In the African region, the WHO implemented a new system called data summarization and visualization. This system serves to better understand the function of the existing tools against target needs.
Okay, so the first key point are the electronic systems such as Go data, and these electronic systems can help with field data collection. They can also help with case investigation, contact tracing, and visualization of transmission chains. It can also help researchers out with field data collection during public health emergencies. And in addition, this electronic data can also help in developing the correct interventions in order to stop the rapid spread of the disease. And the electronic surveillance systems can also support response efforts during a public health emergency.
Okay, so for the second key points is the development of the DSV tool design. The DSV also stands for the Data Summarization and Visualization Tool. So the development for that was the inclusion of the World Health Organization standard data needs and priorities for the COVID-19 response in the African region. Okay, And the second would be the challenges around field data collection, management, analysis, and visualization during the COVID-19 outbreak in member states, and the reporting requirements under the World Health Organization International Health Regulations in 2005, namely data flow from the field to country to region office. This is a continuation of the development of the DSV tool design, which is to facilitate smooth development of robust data collection and contact tracing solution for case-based reporting. Challenges around frequent staff turnover and training needs, the lack of basic infrastructure with key technical, political, and financial considerations, and the ease of use, sustainability, and local ownership. Okay, so the main objective of the DSV tool was to the main objective of the development of the DSV tool was to provide an interim solution for immediate deployment during the COVID-19 outbreak response for field data collection, contact tracing, follow-up, and generating epidemiological information for decision makers in a timely manner. The DSV tool has been deployed in 18 member states in the World Health Organization African region and has been shared with other member states as part of a readiness and preparedness package. And the interim use of the DSV tool is recommended to avoid delays in settings where technical infrastructure and constraints on resources remain major barriers to launching an electronic data collection platform for COVID-19 case-based surveillance.
The strengths of this article is that it's focused on an interim system that had to be used in the African region during the COVID-19 outbreak, where it was hard or difficult to approach the community for data collection. And the weakness is that it would be benefit to verify the efficacy of the DSV in other regions that face technology problems and where the authorities diminish the contagions of the virus exposing the population.
For the reflection, with COVID-19 being a current focus on contact tracing, surveillance, and the response strategies to outbreaks happening around the world, the WHO African Regional Office has prioritized the use of Go.Data among existing WHO electronic data collection platforms in the COVID-19 outbreak context. With this, it was used to ensure early and timely identification of cases, as well as effective isolation and rapid contact tracing to break the chain of transmission. With this electronic data collection, it would make it fairly simpler to reach other places worldwide and faster. However, there can be a downfall to this, as for some underdeveloped countries will not have as much access to it. The group of researchers tried out several approaches in order to develop tools that would help collect the data between the onset outbreaks as well as the beginning of using prioritized electronic data collection platform. Thus, this being said, they created the COVID-19 data summarization and visualization tool, also known as the DSV tool. To create the DSV tool, the researchers had done a great amount of online literature reviews for documents on technical guidance, as well as many published data on PubMed, Medline, Google Scholar databases, and the WHO library database. Another way that they gathered information is by directly approaching WHO teams or by phone call, also by emails or in person. This also helped involve the designing and the implement of the DSV tool. The DSV tool, as stated by Robert earlier, had been successfully implemented in 18 other member states.
The DSV tool was created as an interim solution to support the immediate collection of case and contact data during the initial phase of COVID-19 outbreak response, AMED 2020. The DSV tool also helps to save time in collecting COVID-19 data management, while in the meantime, the electronic platforms of softwares, GoData, A-Works in a Box are deployed for oncoming emergency.
And in addition, for the next health emergency that occurs, electronic tools such as the GoData, the E-Wards in a Box, or eDo's will be utilized in order to detect the outbreak.
This is our reference page, and this concludes our presentation. Thank you.